Now let's take a look at STIs. What exactly is an STI?
STI stands for sexually transmitted infections. It can be acquired in many ways, but mainly through sexual acts such as vaginal, anal, or oral intercourse.
There are many STIs out there, but we will explore some common ones. We will be covering STIs that are caused by viruses. These include HIV and AIDS, genital herpes, and HPV and genital warts. 3 other STIs we will discuss are caused by bacteria. These include gonorrhea, syphilis, and chlamydia.
Let's start with HIV and AIDS. HIV stands for human immunodeficiency viruses.
AIDS stands for acquired immunodeficiency syndrome.
AIDS is a sexually transmitted infection that is caused by HIV. HIV attacks and disables the immune system, the body's natural line of defense, stripping it of its ability to fend off disease-causing organisms.
It can be transmitted through bodily fluids such as blood, semen, vaginal secretions, breast milk, and vaginal, anal, or oral genital intercourse. Symptoms include mild flu-like symptoms, swollen lymph nodes, fatigue, fever, night sweats, diarrhea, and weight loss, also called wasting.
Although there is no cure for AIDS, it can be treated with protease inhibitors. The greatest concern for AIDS is sub-Saharan Africa. 6 times as many adolescent girls than boys have AIDS. In Kenya, 25% of 15 to 19-year-old girls have AIDS compared to 4% of boys. 12 million children and adolescents have become orphans because of the death of parents due to AIDS, leaving them to be cared for by their grandmother or by no one. This usually results in a lifestyle of prostitution or crime. Some differences between adolescents and adults having AIDS is that many adolescents are HIV positive but do not have AIDS, and a higher percent of adolescents' AIDS are acquired through heterosexual transmission. 90% of AIDS occur among men who have had sex with other men. Penile-anal sex involves a high risk of microscopic tearing and therefore blood-semen contact. Asking a date about their sexual behavior is no guarantee protection from HIV. In one study, 34% of men and 10% of women said they lied to their partner so they would have sex with them. The best way to reduce transmission is to increase condom use, delay penetrative sex, and increase partner communication.
Next, we will discuss herpes. There are 2 types. The first one is herpes simplex virus type 1, which is oral herpes, and herpes simplex virus type 2, which is genital herpes. Up to 20% of adolescents have genital herpes.
Herpes can be transmitted through oral, anal, or vaginal activity. It is rare, but it can also be transmitted from toilet seats, drinking from the same cup as an infected person, kissing, and sharing towels. Another type of herpes is ocular herpes that occurs in the eye.
Symptoms include reddish, painful bumps or papules along penis or vulva, thighs, and the butt. Small blisters or headaches, muscle aches, swollen lymph glands, fever, burning urination, and vaginal discharge are all other symptoms that can occur.
Diagnosis and treatment. There is no cure, but it can be treated with antiviral drugs and the vaccine. Synflorix can be used for preventative measures. Individuals often experience severe emotional distress and physical discomfort. A last virus-caused STI is HPV and genital warts. HPV, the human papillomavirus, causes genital warts. Over 9 million individuals in the United States, ages 15 to 24, are estimated to have HPV, making it the most commonly acquired STI in this age group.
It can be transmitted from skin-to-skin contact during vaginal, anal, oral sex, or touching infected towels or clothing.
Although it is difficult to test for, symptoms include hard and yellow-gray warts. This appears on the penis, foreskin, scrotum, and urethra in men and in the vulva, vagina wall, and cervix in the women.
There is no cure, but treatment includes freezing the warts with liquid nitrogen
or covering the warts with solution, gel, or creams, although they may return. A preventative vaccine called Gardasil is also available.
Now, let's look at bacterial causing STIs.
Let's start off with gonorrhea. Gonorrhea is caused by a bacterium that thrives in moist mucous membranes, lining the mouth, throat, vagina, cervix, urethra, and anal tract.
Gonorrhea is transmitted through unprotected vaginal, oral, or anal sexual activity. A mother can also pass it to their newborn during pregnancy and delivery.
Symptoms are more likely to appear in males. The symptoms include penile discharge, which is a clear yellow-green color. Also, when they urinate, it is followed by a burning sensation. Complications in male include prostate, bladder, and kidney problems, as well as sterility.
The symptoms in women include a yellow or a yellowish-green pus-like discharge and burning urination. It may lead to infertility due to abdominal adhesions or pelvic inflammation diseases that it can cause.
It can be successfully treated in its early stages with penicillin or antibiotics.
Now, let's look at syphilis. It can be transmitted through vaginal or anal intercourse, or oral to genital, or oral to anal contact. It can be also transmitted from a pregnant woman to her fetus after 4 months of pregnancy. If she is treated, though, in this time with penicillin, the syphilis will not be transmitted.
If left untreated, it can go through 4 stages: primary, secondary, latent, and tertiary. In the primary stage, painless cankers show up 2 to 4 weeks on vaginal walls, cervix, the labia, the pineal glands, lips, or tongues. In the secondary stage, skin rashes, sores in the mouth, painful swelling of the joints, sore throat, headaches, and a fever appear.
It is something that you do not want. Latent stage can remain dormant for 1 to 40 years. Spirochetes multiply and burrow into circulatory systems, central nervous systems, and bone. Tertiary stage consists of a larger ulcer.
It can be treated with penicillin.
The last and most common STI that we shall discuss now is chlamydia. It can spread through sexual contact and infect the genital organs of both sexes.
Adolescents that most likely screened positive were female, African American, and 16 years old and up.
Many females have few to no symptoms. When they do appear, they include disrupted menstrual cycles, pelvic pain, elevated temperature, nausea, vomiting, and headaches.
In men, it includes discharge from the penis and burning during urination.
Females are usually asymptomatic, so the infection often goes untreated and spreads into the reproductive tracts, where it can cause pelvic inflammatory disease. You can see behind us.
The resulting scarring of the fallopian tubes can result in infertility.
Some researchers suggest that chlamydia is the #1 preventable cause of female infertility.